Hi everybody, Zeev Pellet, plastic and peripheral nerve surgeon here in San Francisco. Let's talk a little bit about headaches and migraines. Many people, including many clinicians, simply consider a migraine to be a very severe headache. The truth is, however, that it is a severe neurologic condition. Now, if you peruse the medical literature, what you'll find is that migraine sufferers typically have certain characteristics. For example, in addition to being very severe, the headaches typically occur more commonly in women, 3 times as many as men. They have a peak incidence in people aged 25 to 55, and they typically, although not always, last anywhere between 4 and 72 hours. They also typically have these phases, which can include the sensation, for example, of a migraine coming on before the actual headache pain begins. That's called a prodrome. Or auras, which are characterized by reports of flashing lights, unusual smells or sounds. Now, while we as physicians can describe many of the characteristics of migraine headaches, at the end of the day, what patients really want to know is, can we figure out what's causing that severe headache? And if so, can we do anything about it? Which really brings me to the question, are all headaches migraines? And the answer is definitely no. Headaches can be caused by many factors that have nothing to do with the chemical or blood vessel related issues that are thought to underpin actual migraine headaches. For example, a brain tumor can cause pressure within the brain and lead to severe headache symptoms. Similarly, pressure or irritation of peripheral nerves, meaning those outside the central nervous system, i.e. the brain and spinal cord, can also cause significant pain. And when these peripheral nerves are located in the head and neck region, for example, in the muscles of the forehead, the muscles that bulge in the temple when we chew, or the muscles of the neck, which hold up these very heavy structures called our heads, that pain is often misconstrued as a typical headache, and when severe, often misdiagnosed as a migraine. But if the problem is a mechanical compression on a peripheral nerve, such as from a spastic muscle, scar tissue secondary to prior surgery or an injury, or an abnormally located blood vessel that's pounding against that nerve, the ultimate successful treatment may not be a medication that's going to alter certain chemicals within the brain, but rather an outpatient surgical procedure that may be able to remove that pressure irritation and thereby provide relief. And that is the essence and concept behind the surgical treatment of chronic headaches, which has been shown to be incredibly effective and very safe. To learn more, click on the link in our bio or go to our website where you can learn a lot more about this type of treatment.